Hi. Yeah, I'm not used to standing up and talking to a lot of people. I'm used to listening, and I've got 20 minutes. I've got 30 odd slides, so I'm not going to go through every detail on every slide, and at times we'll jump. Yeah, I'm the GP in Hereford, which is so thank you, Ifran, for inviting us, and for Gem, and Gem is now combined with Arden, which goes right across to Hereford. So it's all part of your patch, although obviously your patches are more local. I was brought up in Sutton Bonington, so it's nice to be back. And the last time I was in Derby, it was the Rams, the baseball ground in those days. I'm showing my age now. So if we move on, so yeah, Brian was my hero. And I think that's appropriate for patients online. It's not going to happen on one day. Maybe if Brian was involved, it would have done. But yeah, he said some common sense, and I hope there's a little bit of common sense that I managed to say to you. And I don't expect you to rush out and do it all, but if there's one or two little things you can do to move it on for your patients, that'd be great. So yeah, the details are at the end. So, I was a doctor also for Hereford United. Our big day was actually at not Filbert Street, the Walker Stadium as it was, when we moved up into out of the conference. Now we're right down in the Midlands, something or other. But anyway, so football, I was the doctor for them, and that was me misdiagnosing a fractured jaw, by the way. The player went back on, kicked the ball next time, and went down. This guy might have a fractured jaw, it sort of makes you think. There's an old stained glass window. There's is it the web that's the World Wide Web that's coming over? Is he on his mobile phone? Anyway, let's see what patient online. We all know what it involves, hopefully. There's three aspects. There's the appointments, and repeat prescriptions, and the viewing. Appointments and repeat prescriptions, I think we know as transactional things, and as you've seen, going well in Derbyshire, the appointments and the prescribing online. The viewing, obviously last year, we had to try and get people to accept sort of looking at their summary records. And 97% of practices did it on April the 1st. They switched it on. That wasn't particularly useful. The patient's probably saying to you, I can't see anything. It's not useful. I know what drugs I'm on. I know what allergies I've got. Going back to my practice in Hereford, we were talking about 15 years ago, 20 years ago, no, 20 years ago we were moving on to computerization. And then 15 years ago, I was involved with a project to let the patients see their records. We didn't just have restricted bits. Those days it was the lot, and it worked, and that's why I was recruited, I think, into this program. So that's it's easy to function at the transactional stuff, the bookings and the repeat prescriptions. I don't think people have a problem with that. The only thing is how do you set it up. Your suppliers will help you with making sure you can set it up to make it work for you. And there's one or two little clinical things that might come up that you want to go over. I'm there here to answer your questions. So the rest of the world have done it, but obviously health has held back and been cautious, quite rightly, and particularly we've been cautious about the viewing, because those records are not the same as your bank statement. Your bank statement is a private thing to you, but your medical records is even more private. And so until everybody was happy with the processes in the background, the governance, then we weren't going to take it on. We weren't going to, until people like my practice piloted it and found out what mistakes occur, and then gone back to the suppliers and changed that quickly, then they've got it right over the years. Okay, yeah, interest in informatics, I'm not going to show you this because it's quite long, but it's people are interested in the basis of why we've come into using computers for our records. Look up Larry Weed on YouTube. It's a classic talk about why health informatics is a benefit to everybody. They were just sort of talking about it in their hospital at the time. A long time ago, often there's the grey on the video. And in those days, he had a microphone. He actually had it strapped on. That's just additional learning, that was. So this was my practice, if you go onto NHS Choices, you can see we've switched on to viewing test results. We've actually changed it slightly. It hasn't got a slot for viewing test results now on, if I can see. Yeah, we access to medical records and they're all over the place. 6,000 patients. We have 3.5 partners. Since I retired, we have 4 partners. Typical practice, typical patients, lots of easy patients, lots of enjoyable patients, lots of satisfied patients. So what do those patients want? They want to be able to communicate to their doctor or their clinical. They want to be able to chat to them on a web chat. This was a survey done by NHS Choices, and some of these things aren't feasible, possibly, but things are changing, and people are making use of the web in Skype consultations to certain patients. Obviously, it depends on whether they can get to you and all this sort of thing. But there's lots of different variations out there of the way that people are conducting their practice now and changing their practice. I want to say a little bit later about how you can change your practice. Dentist choice tool. My first dentist was just on the London Road down here. That was one of the days of gas, teeth taken out in the surgery. Appointment booking, yeah, we've talked about that. Prescription ordering, they'll want that, and we've got it now. Personalised emails, I think that's almost the same as the web chats. Now, how many of you practices actually put an email address on any of your literature, so your patients can contact you by email? A few. It's coming, but people still don't want to be overloaded. Would much prefer the phone call to start with. But there may be some messaging system you have on your IT system, so people can message in, keep them short. Yeah, there's another one there. Yeah. Yeah, it might be me moving away from the microphone. I'll try and just wave your hand again if I'm muttering again. Okay, move on. Oh, free NHS Wi-Fi. How many practices have that? Good. We can't even get on. It's all about giving information to your patients. Let them look it up themselves. I can refresh their memory before they come in to see you. So where are we? It's a bit of geography now. This is so where's Derbyshire? It's sort of Derby itself. I think it's marked there. You're in the sort of below average, about the same as Hereford where I am. So Nottingham seems a bit higher. Okay. But 30% of adults have never used the internet, so should we be providing it for everybody? But if you provide the online services, then the people who haven't got it can get through on the phone. We're not doing quite so well in this country as the rest of the world, or weren't a few years ago. In order to test out how things were going, NHS England had picked some accelerator sites, and they were selected because they were key practices, really. All the microtest ones down in Southwest, because that's where they got most of their sales. These practices have helped to shape what we've got now. Okay. So I just want to say a little bit about way of using online to change the way we communicate and consult and process. I mean, it's an engineering thing. That's great to do. Rolls-Royce doing the high performance training. I was chatting to them earlier. We need to re-engineer the NHS because the patients can get through so easily now, and they can get the information much more easily. We've got to make sure it's the right information and that we're not swamped. So, as you can see here, a lot of patients want to see their own doctor. As a doctor, I used to think everybody wanted to see me, their own personal family doctor, and it's very protective. But 24% don't, because they're just wanting a piece of information. Same, probably everybody's actually only wanting a piece of information, just the way it's put over is probably why they pick their own doctor, and they've built up a rapport. But they can get that trust of what's on their records, and then if they trust their own doctor who's been involved with that, then they will trust online services. Okay, so this is what's happening at the moment in a study that was done to see what patients say how they're contacting their doctors at the moment, and as you can imagine, most of them are contacting their surgeries by phone. So if we see what's happened with the we're looking now at what the patients actually move on. So this is what they actually would prefer to do. Let's go back a slide, 2 slides. So that's what it was, and that's what they prefer to do. So they're preferring to do online and less of the by phone. And fax machines are now all in the bin, aren't they? Okay, move on. I realise they still are needed by some people. So this is why you should do it. Practice can save money. As a GP, that was one of the things that drove us to. We partly wanted to have a higher quality of records, and we thought if patients can see their records, they can improve the quality. But the services side, it's saving that sort of money, which then you can reinvest in other parts of the practice. Okay, so it's getting that right mixture of the online and the telephone. Patients phone in, 60% can be sorted out, and that's if they're actually going through to a doctor to do the telephone triage, and then that leaves 60% is just phoning in and they're sorted. The other 60%, the other 40% of those are put through to the doctor. The doctor then will, because first of all, they're often asking for prescriptions and were in the past. Then you get down to the ones who want to speak to a doctor. If they're given a chance to speak to the doctor, you're only left with a few that actually need an appointment that day. So this year, the additional bit is the coded record. All the other things we had last year. So you've done the top bit, the bottom bit is what you're being asked to do this year. So it's the detailed records, that's the coded records. And we also asked to increase the bookings. So we're here to help you, so we'll just keep moving, so we're a bit behind. So this is how patients can find out whether what you do. They can look on NHS Choices, put the area in, move on. Then they see whether you've got online appointment booking, whether you've got repeat prescriptions online. I think everybody's got those bits. Okay. So I apologise to TPP in this practice. So therefore, this is what the patients will see. And move on. So our practice, we have all the letters. Everything is available for the patients, and haven't had problems. We've put some quite demanding patients through it, sort of by asking them to be contributors to it. It's sort of patients you think are normally challenging in the consultation, in the consulting room, such as one that his wife had brain cancer, and he was anxious. They always came in together, and he was really anxious. And I had a chance to talk to her on her own, and said, "Your husband doesn't seem to be listening. What about sharing the records? Would that help?" She was all up for it. She could understand what was said, but I was having to try to re-explain it to him at home and found that difficult. So we let him share the records. Obviously, she was in control, and I had a chance to speak to her because we were always worried about the proxy side of it, proxy access that we'll mention later. But amazingly, the consultations just dropped. He could see the hospital letters, he could see my notes, and I could now communicate with him. I couldn't communicate verbally, and we tried different ways of explaining it. But once we actually let him read it, he then could get the gist of what was going on. He could spot those things. He was quite sort of a fastidious sort of person, and he could get those bits of information that helped him. Okay, I think we'll just wind through now. So this is the main thing we found in our practice, is that even though only a few patients actually had record viewing, they trusted us because they were posted up saying you can view your records. A lot of them didn't want it, but they trusted us that they could see it if they wanted to, and it's that trust, I think, which you can't measure, can you, very easily. Okay. I'm just going to skip to the next one, which is the next one. What GPs are worried about. And how many GPs we've got here? Good. Yeah, you may recognise some of these. I think it's been around now for a year or two, and I think people are starting to accept bits of it. So you're laughing at the retirement bit. Okay. The practices, there are some challenges, and the NHS patient online team are there to help you. I'll show you how you can help. We'll move on a bit because I'm running behind. So SMS texting, we mustn't forget. We must keep that. I was lobbying to try and keep it paid up top. It's now got down to the CCG. But anyway, we must. It's a one way of communicating. So just want to tell you what our team do, supporting you in different ways and supporting patients. So yeah. So if you need any help, contact me. I really want to try and get the information to the patients with the diseases.